Well, I think that the points that Vanny has made and Dr. Ismail has made as well are both speak to our experience with the system in a number of ways. Initially, accessing treatment is difficult. I feel that family members trying to obtain help for a relative often feel that they're not listened to, and I mean that goes along with the consent and capacity issues. Going forward, though, I think it's also important to recognize that there are many facets to moving through recovery. And a lot of them are not just focused on the initial access to treatment. Once you have initially accessed treatment, then there are social supports that you need moving forward, and employment supports, financial supports, transportation assistance. And although there may be a lot of very good programs out there, as Vanny mentioned, some of them are certainly overloaded. And in addition to that, the coordination of those services is limited in some cases, making it very difficult for family members or our relatives to negotiate the system. So really that's what it is. I mean, in my view, we could benefit a lot from trying to streamline what we have, bring it together, and take services that are effective in certain areas, use those services as best practice, if you will, in other areas.
Thank you, Peter. Now, Michael, in terms of the issue of discrimination and stigma, what would have been some of your experiences?
First of all is social stigma from society. Unfortunately, society is not educated enough to understand the struggles of somebody who has schizophrenia like myself. Because people don't understand you, it means that they are fearful of you. And if they're fearful of you, they don't want to have anything to do with you. The other thing is that the reason why I cannot blame society 100% is because, unfortunately, a lot of people like myself with schizophrenia can't communicate your difficulties, your problems, in a very clear and concise way. So if someone with schizophrenia can't describe what he or she is feeling exactly, then it's very difficult for healthcare providers like doctors, social workers, so on and so forth, to help you out.
Mm-hmm. Dr. Ismail, do you want to comment on that?
I agree. I think, first of all, the media often worsens stigma of mental illness by overtly or covertly equating severe mental illness and violence or aggression. And while there is an overlap there are many people who are violent and aggressive who do not have mental illness. So this supports Michael's notion that people are often afraid of people with schizophrenia. And that's quite unfortunate. Also, in the midst of perhaps a major episode, it is difficult to communicate one's needs and wishes if they're clear at all at that point, and that further puts up barriers to accessing treatment and getting acceptance in society in general for this as an illness in the same way that kidney or a cardiac illness would be acceptable.
Michael?
Yeah, because society as a whole can't understand you completely. They automatically label that if you have schizophrenia, you have a split personality.
And actually, I'm going to pop it back to Dr. Ismail. Can you actually just give us a quick definition of schizophrenia? Because Michael, of course, has mentioned that it isn't split personality.
Certainly. The public's misconception that schizophrenia is a split personality is very common. But in reality, what it really refers to is often a chronic illness that has a sort of often a downward course over certain periods that really affects people's ability to function in society. There are sometimes impairments in cognition, the ability to think, attend, concentrate, and there often can be hallucinations and delusions. So hallucinations are when people perceive something through their eyes or their ears when there isn't a stimulus, and delusions, which are fixed false beliefs that are unamenable to reason and not consistent with cultural beliefs. So the definition is much more broad and complex than simply someone who hears voices or this erroneous notion of split personality.
Okay, now Vani, in terms of the general public and their perceptions, would you say that the general public actually realizes that access to treatment is a problem?
No, I would not. I think that there is an assumption amongst the general public that if somebody needs healthcare, that they can access it without problems. And even I myself, was quite shocked when I started working in this sector and I started talking to people with mental illness and their families at the stories that I heard about the walls that people came against when they were trying to access care. I think, if you have a sore throat or something like that, or another physical ailment, it's quite easy to go to a walk-in clinic, even if you don't have a family doctor, and get the care that you need. But people with serious mental illness, it's not as easy for them. They're often denied care. And I think, both Michael and Dr. Ishmael pointed to that issue of stigma and discrimination. It's very real that people are denied care because the behaviors that they demonstrate are such that sometimes people just don't want to deal with them. Being told that you're too sick to access a certain program or not sick enough is a reality. And, I think the Ontario government has taken great strides to improve access to care for things like hip replacements and MRI and CT scans with the Ontario Wait Time Strategy. And, what we believe is really that the government needs to take those same steps in improving access to psychiatric care or care for serious mental illness. And I think the public will get on board once the government does.
Now, Peter, in terms of, from a family member perspective, what sort of issues have you seen?
Well, I think from the beginning we had a difficult time getting help to start with, to be quite honest with you. I mean, and let me just position it this way with you. If you're a young individual, okay, in high school, and you and your friends don't have the right idea of what mental illness is all about, okay, which we've just around this table here agreed that in general society is not educated properly on a lot of it, right? So you partake in these discussions with your friends. Now, all of a sudden, you start to experience things that are different. You start to experience hallucinations. You maybe start to experience delusions. Are you going to come out and talk to people about that? Right? Are you going to talk to your parents about it? Or are you going to talk to your friends about it, knowing how they feel about it? Right? So I think at the core, one of the biggest walls we run up against is the stigma and the fact that society as a whole doesn't view it properly. So people are afraid to talk about it. If you're afraid to talk about something that's happening, then you're not likely to pursue help. Going forward, as a family, we encountered a lot of difficulty getting education for ourselves. The way the system's currently structured, our relative will go into essentially an acute care model. In most cases, they are returned to us. Okay, and it's up to us to provide the ongoing support and monitoring. And that's the structure of the system. In order to do that, we need to be properly educated on what it is that we can do to provide the best possible opportunity for our relative to recover. And accessing those educational services was very, very difficult when we started through the system. Again, very good opportunities are out there, but the integration is not there. We entered things through the justice system because we couldn't get into the system through the medical system, which is not the right way to go. So again, we had a barrier accessing the medical system. We entered into the medical system via justice, which is no place for someone who's not well. There are just too many opportunities for that to